This recording is part of the series of recordings that cover the physiology of the circulation, or hemodynamics. Now, blood pressure is an important concept. It's an important factor in your circulation because it determines blood flow. So remember, the flow equation is this. So blood pressure would be this part. So what we're going to do, today is we're going to be talking about just, the arterial blood pressure. But before I do that, I want to remind you that that pressure that we have, or our blood pressure, it's a pressure exerted by the blood on the wall of the blood vessels. And we will use a tool called a sphygmomanometer to record it. But you'll see here that the heart created a pressure to open up valves and get blood moving, and that blood is kind of exerting a force upon the wall. Now, that pressure you see right here, and what you'll also notice on this the picture below, you see cardiac output, you see resistance. Well, the flow, your total flow in your body, is your cardiac output. And it's determined by blood pressure, specifically a pressure difference. And so I'm going to substitute delta P for mean arterial pressure, because this is what we're going to mention very shortly. And this is over resistance, and this is what you see here. And resistance, we're going to replace with total peripheral resistance. So this represents the resistance in your circulation. Your cardiac output is the Q. So you kind of see that flow equation now applied slightly differently. And what we're going to address is we're going to be looking at your mean arterial pressure. Now what I'm going to do is I'm going to rearrange this equation here. And so what you see is this. So the blood pressure is mean arterial pressure. It's equal to your cardiac output times total peripheral resistance. So according to that equation, if I increase cardiac output, don't affect your resistance, mean arterial pressure would increase. If cardiac output decreases, mean arterial pressure can decrease if I don't change total peripheral resistance. If this stays the same and I change this, I will have, again, a direct relationship as I have with the cardiac output. If I increase resistance, I'll increase mean arterial pressure. If I decrease resistance, I would decrease mean arterial pressure. So that's just one way of looking at it. And we're going to look at that again when we look at it, the control of blood pressure, and that's in a separate recording. So why do we refer to as your blood pressure as your mean arterial pressure? Now, clinically, we often use that mean arterial pressure because the blood pressure in your veins is essentially insignificant. So we talk about your mean arterial pressure. It's an important pressure, and it's a pressure that drives blood from the heart through your circulation. It's needed for perfusion of tissues. Now, we use a sphygmomanometer, a blood pressure cuff, to measure blood pressure. Uses an indirect measurement of blood pressure, and you'll learn about a little bit this in lab. Now, when someone takes your blood pressure, they're going to be recording two different values. The top pressure is your systolic blood pressure, which you see here. So I'm just going to abbreviate it SBP. The bottom pressure is referred to as your diastolic blood pressure. So there'll be a separate recording if you're interested to look at how blood pressure is recording using this method. But the high pressure, the systolic blood pressure, represents the peak pressure that you get while the heart's in systole, hence the term systolic blood pressure. The diastolic blood pressure, that lowest pressure that's being recorded, it represents what we're having when the heart is relaxing or in diastole. Now, the mean arterial pressure, a way for you to calculate it is if you take someone's blood pressure and say you got those two values, and we'll say here, we'll use these values, the 120 over 70. So 120 over 70. These are two equations. Either of them will work. It's dependent upon which one you prefer. Is you can calculate someone's mean arterial pressure based on what you've gotten from taking their blood pressure using that sphygmomanometer. Now, what it is, it's your pulse pressure divided by 3 plus the diastolic blood pressure. This is the one I use. You'd get the same answer if you use this. So either works. So the thing is, what is pulse pressure? So I got to talk about pulse pressure, and then we'll come back to this equation. So here, let's look at this recording. So here represents, say, an aortic pressure recording. The values that you're getting are from an insertion of a transducer directly in the vessel, and it's recording the peak pressure, the systolic pressure up here, and the lowest pressure that's being recorded. This is very similar when you do that indirect measurement of taking blood pressure using the blood pressure cuff. It's less invasive than cutting someone open and sticking a transducer in an artery. So this is very similar to what you would get in the aorta. So the peak pressure in this scenario was 125. That's the systolic blood pressure. The lowest pressure is the diastolic. It was 80. And the units are millimeters of mercury. So you always have to use units here. The pulse pressure is the difference between systolic and diastolic blood pressure. So in this case, 125 minus 80, and the units are millimeters of mercury. And so what's the pulse pressure? In this situation, it's 45 millimeters of mercury. In the previous scenario, this would be what? This would be 50 millimeters of mercury. Okay, so what does pulse pressure tell us? Well, one of the things that pulse pressure gives you an indication is I want you to think about when you say someone takes someone's pulse. When you take someone's pulse, you're feeling actually a pressure wave that traveled through the arteries following the left ventricle contracting and expelling that blood out of the heart. It's a pressure wave that was created when that blood left the heart, went into the aorta expanded out, but then it recoiled and it's starting to propel blood away from the heart. But that pressure wave actually is transmitted faster than the actual blood, but you're feeling that recoil. And the pulse pressure, the value of that, or I should say the magnitude of that pulse pressure, will be greater the greater the difference between systolic and diastolic pressure. So if you've got a lot of blood leaving the heart, what can happen is the systolic pressure is going to increase, and so pulse pressure will increase, and it's actually going to be felt as a stronger pulse. If you don't have as much blood leaving the heart, you're not going to stretch out that aorta as much, you won't have as much recoil, this pressure won't be as high, and so pulse pressure would be lower. Changes in diastolic pressure can also affect what your pulse pressure is. If your diastolic pressure is high and your systolic pressure is the same, that could make that pulse pressure less. If the diastolic pressure is low, that can make your pulse pressure high. Thing is, what type of things could affect these values? Well, things that can affect your systolic pressure or your diastolic pressure could be resistance in that circulation. It could be reflective of the amount of blood leaving the heart. That would affect, say, the systolic pressure. The diastolic pressure could be influenced if the blood is moving away from the heart very quickly. Diastolic pressure can actually drop because, remember, the pressure is created from that blood pushing up against the sides of the wall. So if that blood's moving away from the heart very quickly, diastolic pressure can be lower. If the blood doesn't really have a place to go, that blood is going to be pushing up against the sides of the wall, and diastolic pressure would be high, and that could happen, say, if it's encountering some sort of resistance. So different things could affect that pulse pressure because they could affect the systolic or diastolic pressure. Things like stroke volume, I'm going to write these down, could affect pulse pressure, and something called compliance, how compliant that artery or that aorta is. That could also affect pulse pressure. So different things could affect the pulse pressure. Now, do not correlate pulse pressure directly with mean arterial pressure. This is the reason why. So I'm going to come back here. mean arterial pressure, or most of your pressure, comes from your diastolic blood pressure, because you tend to spend more time in diastole than you do systole. So diastolic blood pressure contributes more to your mean arterial pressure than your systolic pressure. A mean arterial pressure can be perfectly normal, and this pulse pressure be either high or low. Or I could have a mean arterial pressure being abnormal, but the pulse pressure be normal. So they're just different clinical tools that could help someone in looking at a patient. And I can't really go too far in depth, but I'll use some examples in class to kind of show you where that don't automatically assume if someone's pulse pressure is high, their mean arterial pressure is high. Okay, so I don't want you to do that. But I do want, since we're here, let's just do a real quick example of calculating mean arterial pressure. So we said this person's systolic was 120, their diastolic was 70 millimeters of mercury. Their pulse pressure was 50 millimeters of mercury. Okay. What is their mean arterial pressure? Well, according to this equation, it's a third of your pulse pressure plus your diastolic blood pressure. Now, when you do this, you don't express pressures in using any type of decimals. You'd have to round to the nearest whole number. So 50 divided by 3 is what? It's like 16 point something. So it's, let's see, it's 16.2, let's see, 2. It's going to round up to 17 millimeters of mercury, if I did my math right. Plus 70, the mean arterial pressure is 87 millimeters of mercury. Okay, so what do those values mean? Okay, so in a normal adult, the normal range for mean arterial pressure is between 70 and 105 millimeters of mercury. This is a normal range. Normal range for pulse pressure is between 30 and 60 millimeters of mercury. Typically, like the average mean arterial pressure is anywhere about 90 to 96 millimeters of mercury. Pulse pressures average usually around 40 or so millimeters of mercury, but these are normal ranges. So let's go back to our scenario. So in both of these situations, mean arterial pressure is 87 millimeters of mercury. That's normal. A pulse pressure of 50 millimeters of mercury is normal. Okay, so in this scenario, everything's good. Okay. What I want to show you now is what happens to mean arterial pressure and pulse pressure as we move through the circulation. So let's just look at your mean arterial pressure first, which is right here. Okay. So you see the average, it's in here, it looks more like 96, 98-ish or whatever. So here is your mean arterial pressure in the aorta. It starts to decline as we're moving through the circulation. And then you know before you hit the capillaries, there's a big drop. It's pretty steep here. Key thing here, those resistance arterioles. We're going to encounter a lot of resistance. Those are going to be responsible for decreasing that mean arterial pressure quite a bit before they make their way to the capillaries. And the average pressure, mean arterial pressure in the capillaries, in the systemic circulation, is about 17.3 millimeters of mercury. So we started off about high 90s, and you get down to 17.3. Not a problem. As long as we have a pressure difference, you could be able to get perfusion of those tissues. I want to drop that pressure because once you get to the capillaries are very thin-walled. I do not want to damage those capillaries. Also, and it will continue to decline until we get to the vena cava. It's pretty much 0 millimeters of mercury. So by the time it makes its way back to the heart, it's 0. As long as you have a pressure difference, blood will continue to flow through the circulation. Pressure's dropping through your circulation because it is encountering resistance and it continues to drop. Pulse pressure. So I said pulse pressure is that difference between systolic and diastolic. So you see here, here's peak systolic, here's diastolic, and you see, I'm going to do it in green. See, it's pulsatile, and then all of a sudden you hit those resistance arterial and bam, it's like a flat line. The resistance arterials are also responsible for decreasing pulse pressure. It's going to allow that pressure to be more continuous, or not continuous, having the damping of that pulse pressure is going to prevent pulsatile flow through the capillary beds. You want smooth, continuous flow through those capillary beds. And by reducing that pulse pressure, we're able to do it. Up here, you see more pulsatile flow here. So this will be, that pulse pressure is going to be reduced. The mean arterial pressure is reduced. Specifically, part of the circulation responsible for that is those arterioles. We have kind of smooth, continuous flow on, therefore, or from then on. Okay. Now, I might as well do one scenario for you. So I'm going to give you some values, and then you're going to calculate them for me. So let's do here. Okay, so I'm giving you 3 scenarios: scenario green, scenario blue, scenario red. I'm giving you their systolic blood pressures. I'm giving you their diastolic blood pressures. Calculate their pulse pressures, and then calculate their mean arterial pressure, and then tell me, are any of them normal, high, or low? So you can pause this recording to do your calculations, and then you can come back to see if you're right. So feel free to pause. Now, I'm actually going to work through these. So the first scenario, if I have a blood pressure of 120/80, that's all I would say. That's kind of Guyton numbers. So if someone has like 100, I'll explain to you what Guyton numbers are at a different period of time. But these are like, I should say, just typically values that you would see in medical textbooks, because one of the standards for medical physiology textbooks was written by a medical doctor with the last name of Guyton. So if I have a blood pressure of 120/80, what's my pulse pressure? 120 minus 80, that gives me 40 millimeters of mercury. Okay. A third of 40, figure out what that is. And then I add it to the diastolic blood pressure. So if I do that, I should get a mean arterial pressure of about 94 millimeters of mercury. All right. Both of these, N means normal. So both those are in the normal range. Second scenario, we have 160/120. So we notice systolic and diastolic blood pressures are both going up. Pulse pressure, 160 minus 120 is 40 millimeters of mercury. It's the same as we had previously, same pulse pressure. But if I calculate their mean arterial pressure, third of 40, figure that out, then add it to 120. If I do that correctly, I got 134 millimeters of mercury. The pulse pressure is normal, but the mean arterial pressure is high. Okay? Last scenario. Systolic blood pressure 150 millimeters of mercury, a diastolic of 30 millimeters of mercury. If I do that, the pulse pressure is 120 millimeters of mercury. And if I calculate the mean arterial pressure, I get 70 millimeters of mercury. A third of 120 is 40. 40 plus 30 is 70. So when I look at this, that pulse pressure is high, very high. The mean arterial pressure is still actually in the normal range. Now we're starting to get to that cutoff where it could be low. So this is one of the things I said. Don't, you're just like, oh, that systolic pressure is high. Their blood pressure has to be high. No, if anything, their mean arterial pressure is a little lower than you thought. So these are all real life examples, things that could happen. So I just wanted to do these as examples in class, we'll discuss what scenarios would result in this, okay? Why someone's pulse pressure may be perfectly normal and their blood pressure is high, or their pulse pressure is so high, but their mean arterial pressure is still actually normal, and if anything, it might actually be lower if this, say, was even lower than 30 millimeters of mercury. So I'm going to leave it here. Next recording, we're going to look at principles of capillary exchange.